Imagine stepping into a city that was just a couple years back filled with life and now turned into a ghost town. Walking through the city, you could see misery all around you, and everybody was scared of being the next one. Welcome to the year 1348, a year carved into history by the Black Death, the deadliest plague in human history. Now, amidst this apocalypse, a figure emerges from despair: the Plague Doctor. Dressed in his iconic beaked mask and dark waxed clothing, he was the last hope for the ill-fated and the doomed. Since nobody was familiar with the disease, everybody prayed to the Plague Doctor that he would be able to save them from the same fate millions of others have already met. During this time, these people were more than just a doctor. They were seen as heroes of their time, and yet most schools barely teach about these men. Welcome to Past Perspective. And today we are looking at the horrors the Plague Doctors had to confront on a daily basis for years, all while they were risking their own lives. But before we dive in, make sure to subscribe to our channel so you can learn about all the history topics nobody taught you in school. Now, first of all, let's take a short look at where the plague came from. While there are many theories on how it really came to Europe, historians from all around the world are pretty sure that this is probably what happened. In 1347, 12 boats arrived at the Sicilian ports. They were packed with goods from the Far East, but once the dock workers stepped foot on the ships, they were greeted with death. Almost all sailors were dead or barely alive. When you looked at their skin, they had black parts on it and boils that dripped blood. At this point, nobody knew that they were bringing a deadly disease with them that would take the life of more than 100 million people. This disease, known as the Black Death, hit Europe hard and fast. It didn't matter if you lived in a small village or a large city, in a humble house or a grand castle, no one was safe. The speed and scale of the devastation were mind-boggling. See, people back then didn't understand diseases the way we do now. They didn't know that fleas from rats were spreading this deadly disease. All they saw was their friends, family, and neighbors falling ill and dying at an alarming rate. It was terrifying, not knowing where it came from or how to stop it. Imagine living in a time when seeing a pile of bodies in the street was an everyday sight. Imagine the fear and despair people felt as they watched their loved ones succumb to the disease. That was the reality for people living during the Black Death. And in the middle of all the fear and death, some people stepped up and decided to help the sick and dying when no one else could or even would. A new type of physician began to appear in the towns and cities of Europe, the so-called Plague Doctors. These men were specifically chosen to treat the Black Death's victims. Often, these were second-rate physicians who weren't able to establish a practice, or young physicians seeking to establish themselves. They were contracted by towns and cities for specific periods to treat and care for plague patients, regardless of their wealth or social status. This was not a role many aspired to. It was risky and terrifying. The plague was highly contagious, and the doctors were exposed to it daily. The only reason why someone would be willing to expose himself to a danger like this is because the plague doctors got paid extremely well by the town or city that hired them. At that time, as I said earlier, the Plague Doctor was the last hope for those that got infected with the plague. But the question is, what did they even do to help the ill since there was no cure for them? Their responsibilities were many, but the primary one was treating the ill. They tended to those suffering with care, attempting to relieve symptoms and prevent the disease from spreading. This could involve lancing buboes, the painful swollen lymph nodes associated with the plague, or recommending treatments ranging from bloodletting to applying herbal remedies, but we are going more in detail on that later on. Their duties extended beyond the medical. They were also expected to record in public records the deaths due to the plague, which helped keep a tally of the mortality rate and provide crucial data on the disease's spread. On occasion, they performed autopsies to better understand the disease, but this was rare due to religious and cultural taboos. What's even more shocking is that their services were not restricted to humans either. In some regions, plague doctors even inspected and treated animals to prevent the spread of the disease and to ensure people had enough food. Inevitably, their daily exposure to the deadly plague necessitated some form of protection. This led to the development of the iconic Plague Doctor costume, which now for many is a symbol of the plague. The outfit consisted of a waxed fabric overcoat which was supposed to be impermeable to the bad air. See, back then, people didn't know how the plague worked and they believed that it was spreading through the air. Therefore, the plague doctors were wearing all leather so they wouldn't get in contact with the infected air. Another thing they wore were their leather gloves that have been extended up to the elbows, protecting the hands and arms from contact with infected patients and contaminated surfaces. But the most chilling aspect of the outfur was their mask. It had a beak-like shape intended to hold aromatic herbs and spices believed to purify the air breathed in by the doctor. Glass eye openings ensured visibility while keeping the doctor's face enclosed. A wooden cane, often seen as an accessory in depictions of plague doctors, was a multi-purpose tool. It was used for examining patients without touching them, directing family members to move patients or items, and sometimes defending themselves when patients became delirious or aggressive. Despite the crude and rudimentary nature of the outfit by modern standards, it was one of the earliest attempts at personal protective equipment. Each day, their mission is the same: to save as many lives as possible from the clutches of the deadly disease. House visits form the backbone of their workday. The physician's staff would knock on the door, the sound echoing in the usually quiet streets. Inside these homes, they would encounter scenes that even the bravest of hearts would find distressing. The air would be heavy with despair and the unmistakable odor of sickness. The doctor would move from patient to patient, their gloves touching hot, feverish skin, their eyes taking in the painful swellings known as buboes, all while trying to offer some semblance of comfort. They would lance these buboes to release the buildup of pus, a task as painful to perform as it was to endure. Following the house visits, the doctor would partake in their public health duties. This often involved inspecting local areas for signs of further infection, advising on quarantine measures, and checking in on quarantined individuals. Every cough heard, every pale face seen would be a potential new case, a new life on the line. The day doesn't end there. Back in their quarters, the doctor's responsibilities continue. They must document the day's cases, a task both administrative and deeply unsettling. Each name written is a life hanging in the balance, a stark reminder of the disease's deadly potential. Unfortunately, the plague doctors weren't able to help as they were trapped in the medical theories of their time. They had a theory that the human body consisted of 4 so-called humors, and any imbalance in these humors led to illness. Therefore, their treatments focused on restoring this supposed balance, which led to bloodletting being a common practice. This process was incredibly painful for the patient and only made the disease worse. Another treatment they had was purging, a method intended to cleanse the body. The patient was made to vomit, again in the hope to lose the bad humors. Some plague doctors would also resort to a cocktail of remedies, often more fantastical than practical. These ranged from applying crushed gemstones or arsenic on the buboes to using noxious smoke to purify the air. Yet these methods were highly ineffective, and the harsh reality for those that got the Black Death was that there was no return to health. Most of the times, the plague doctors would share the same fate their patients met. Despite their protective gear, the plague doctors were far from immune. The beak-like masks filled with aromatic substances, the waxed overcoats, the leather gloves, all these were rudimentary defenses at best. The contagion, borne by fleas and transmitted by rats or human contact, was hard to avoid completely. Sadly, many plague doctors fell prey to the very plague they were fighting against. Historical accounts suggest that several of them contracted the disease and met with an untimely demise. The life expectancy for a plague doctor during the time of an outbreak was grim, and most of them got the plague within the first few months of working their jobs. The overall experience of a plague doctor was not only incredibly dangerous for their bodies, but also mind. Seeing people die in despair day after day left marks in their souls, which made it one of the most terrifying experiences you could ever make. Thank you for joining us today. If you enjoyed this video, make sure to check out the next one and don't forget to subscribe to our channel.